Sound check, sound check. Hi, folks. Professor Gulliford from Autry Technology Center. Many of you know me from previous years of doing your medication nebulizer training. This is something that the state requires us to do. When you don't have a respiratory therapist in-house, nurses can do respiratory therapy procedures. They just need to have an annual competency checkoff. So that's what this video will accomplish. I certainly enjoyed being out there. We had a great turnout on October the 4th. But this video is for those who could not be there. And here we go. Let's do a share screen, share sound and video. And I'm going to use with you folks the same procedure card that I brought to the facility and that I also left a supply of there. This is a accredited CEU. Some nurses have a requirement to submit CEUs for a specialty or perhaps the Kansas license. I'm aware there's no requirement currently in Oklahoma. But at any rate, it is an accredited CEU, and I left certificates out there, which I have signed. This is medication nebulizer. I wanted to start by saying that we do have an important development in the medication nebulizer world, and that's what's called the breath-activated nebulizer. This is a real improvement, and it was such a help during COVID. I am shipping to your facility 2 of those so that you will have them if you have a patient that truly needs one. If you have a patient that needs every bit of medication, no wasted medication, breath-activated nebulizer is definitely the way to go. If you have a patient that has a contagious condition that we don't want to disseminate into the room with aerosol, then definitely breath-activated nebulizer is the way to go. You'll have a couple of them on site. If you use those, let me know. I'll ship you some more. Let's see here. What else could I say? I think that's about it. Let me walk you through the procedure here. I'm well aware that you've done breathing treatments and that you are competent to do this. That's simply a requirement we must do from a licensure standpoint. Medication nebulizer, MedNeb treatments, verify a physician order, of course. Review the chart and find out why you're doing the treatment. Once in a while, I receive an order for a respiratory therapy treatment that makes no sense for the patient. So I contact the doctor and say, why are we doing this? And once in a while, it's the wrong patient. Or maybe the doctor was thinking about a different type of therapy and just wrote down the wrong or typed the wrong therapy. So review the chart. Make sure you understand why we're doing the treatment. Standard precautions, of course. Obtain your equipment. Prepare your medication. Today, it will almost always be unit dose. So it's all ready to go. You just bust open the little vial and put it into the nebulizer. Monitor before the treatment, heart rate, respiratory rate, breath sounds, and peak flow if ordered. I don't think you'll be doing peak flows in your facility. If you ever got an order to do that, let me know and I can send you a peak flow meter. But I doubt if you'll be doing peak flows. It is important to do heart rate, respiratory rate, and breath sounds before the treatment. Then begin the treatment. 8 liters per minute is perfect. I believe in your facility, it's going to be an electric nebulizer generator. I hope I'm using the right term there. Yeah, you're just going to use a small portable nebulizer and instead of plugging into oxygen. But if you get a chance to use oxygen, it would be 8 liters per minute. Coach and encourage the patient. Every 3rd to 4th breath, we have them take a slow, deep breath and hold it. We can't realistically have them take a deep breath and hold it every breath. The patient's not able to do that. But every 3rd to 4th breath, and that's when the best deposition of medication is happening. That's when the most medication is actually settling into the lungs to have the full benefit. Today's nebulizers are awesome. They are just great, particularly the breath activated, but they make particles of about 2 to 3 micron size, which is perfect to go in the lungs and then stay. If the particles are smaller, the patient actually exhales the particles. That's not good. If they're larger, then the particles land in the upper airways. That's not good. We want them to get as deep into the lungs as possible. Slow, deep breath and hold. My experience is most patients can hold their breath for about 3 seconds. Monitor during the treatment, heart rate, respiratory rate, any adverse effects. We stop the treatment for a heart rate increase more than 20. So if we started the treatment and the heart rate was 70 and the medication made their heart rate go up to 90, we would stop the treatment, notify the doctor. The doctor might say, that's okay, we can live with that. Or the doctor might say, well, let's try a different medication. They might switch the patient from albuterol to levoalbuterol, which is Xopenex. That is at least a possibility. But our job is to notify the doctor that that heart rate increase did happen. Stop the treatment at the sputter point. What I mean there is that once the nebulizer is sputtering, and that's probably about 10 minutes, given the equipment that you're using, then nothing good is happening. It will continue to sputter for another 5 or 10 minutes, but it's not doing any good for the patient. The particles aren't even getting to the lungs at that point. At the end of the treatment, monitor heart rate, respiratory rate, breath sounds, peak flow if ordered, but probably not. Encourage the patient and assist with coughing. Ask them if they have any questions or concerns, and educate. This is your opportunity to help the patient understand their condition better, and then chart the treatment in whatever method you are using to chart treatments. That's it, folks. Medication nebulizer therapy is very safe these days. It is important. Certain patients that you will have definitely need it, and need it on a regular basis. So we need to be able to do it safely. That is it. Let me give you my cell phone in case you would have a question or need something. 405-219-6715. That's 405-219-6715. Professor Daryl Gulliford at Autry Technology Center. My email, if that would be helpful, dgulliford, just like you see on the card there. Hey, I can put it at the top of this thing. Let's do that. dgulliford at autrytech.edu. And the cell was 405-219-6715. I'm here to help in any way that I can. I think that's it.